Hello, everyone. I'm Dr. Yendi. Let me ask you a simple question. When was the last time you had a full health checkup? Last year? 5 years ago? Never? For many people, the answer is surprisingly uncomfortable. Most of us service our cars more often than we check on our own health. And yet, there's another side to this story. Many people spend thousands of dollars every year on executive health packages. Blood tests, scans, ultrasounds, tumor markers, stress tests, whole body MRIs. And even with all that testing, they may not actually live longer. So today we're going to talk about one of the most misunderstood topics in modern healthcare, the annual health checkup. What works, what doesn't, what the science really says, and how technology is changing the future of preventive medicine. Let's start with a surprising fact. Many large medical studies have found that routine annual health checks do not always reduce overall mortality as much as people think. That sounds shocking. After all, shouldn't more testing automatically lead to better health? Not necessarily, because healthcare has a major challenge. Finding abnormalities is not the same as improving outcomes. The human body contains countless harmless variations, small cysts, tiny nodules, benign growths, incidental findings. And the more aggressively we search, the more of these we uncover. That creates anxiety, more tests, more biopsies, more expense, and sometimes unnecessary treatment. This has a name: overdiagnosis. And it is one of the hidden problems in modern medicine. But before you conclude that health checkups are useless, let's look a little deeper, because there's another side to the story. Many of the world's most dangerous diseases develop quietly. High blood pressure, type 2 diabetes, fatty liver disease, coronary artery disease, kidney dysfunction, certain cancers, sleep apnea, metabolic syndrome. People often feel completely fine until the disease is already advanced. By the time symptoms show up, the condition may have been developing for years. That's why preventive medicine exists, not to find everything, but to find the important things early. The challenge is knowing which tests matter and which ones only create noise. This is where modern medicine is changing fast. Traditionally, health checkups focused on finding disease. Tomorrow's healthcare will focus on predicting disease, and that's a very different idea. Imagine two patients. Both look healthy, both have normal blood pressure, normal cholesterol, normal routine blood work. Yet one will develop heart disease in 5 years, the other won't. Traditional testing often struggles to tell them apart. Modern medicine is trying to solve that problem. Let's talk about the traditional annual checkup. Most health packages include complete blood count, blood sugar, liver function, kidney function, lipid profile, urine testing, physical examination, blood pressure, electrocardiogram, chest X-ray, and sometimes abdominal ultrasound. These tests are still valuable. They catch many common diseases. They're relatively affordable, widely available, and supported by decades of clinical experience. For many people, this basic foundation is still essential. But medicine today is moving beyond the basics. Why? Because many diseases begin years before routine tests become abnormal, and technology is now giving us a much earlier view. Take cardiovascular disease. Heart attacks don't happen overnight. The process often starts decades earlier. Inflammation, plaque buildup, endothelial dysfunction, arterial calcification, all of it happening silently, long before symptoms appear. Modern tools such as coronary artery calcium scoring can detect plaque years before a heart attack happens. That's a major shift. Instead of waiting for disease, we can measure it directly. Now let's talk about body scanning. This is where medicine gets controversial. Whole body MRI has become increasingly popular. Celebrities, executives, athletes, biohackers, longevity enthusiasts. Many people now choose comprehensive body imaging. The promise sounds irresistible. Scan the entire body. Find hidden disease. Save lives. Simple. Right? Not quite. The advantage of whole body MRI is clear. It can detect tumors, aneurysms, organ abnormalities, certain neurological conditions, and unexpected findings, all without radiation exposure. But there's a catch. The body contains many abnormalities that never cause any harm. The more thoroughly we scan, the more incidental findings we discover. Some need follow-up. Most turn out to be harmless, but anxiety often comes first. That's why whole-body MRI remains controversial, not because it has no value, but because interpreting what it finds takes real expertise. What excites me even more than imaging alone is integration, combining imaging, blood biomarkers, genetics, wearable technology, lifestyle data, and artificial intelligence. That's where healthcare becomes truly personalized. Imagine a future health checkup, not a single day in a hospital, but continuous monitoring all year long. Your smart ring tracks sleep, heart rate variability, recovery, stress, respiratory rate, activity, body temperature. Your blood tests update regularly. Imaging is done strategically. Artificial intelligence spots patterns. Risk scores change over time. Your health profile becomes a living system, not just a once-a-year snapshot. That future is already beginning, and it represents one of the biggest shifts in healthcare history. From episodic medicine to continuous health intelligence. Let's talk about speed. In the past, medical reports could take days, sometimes weeks. Patients waited anxiously. Today, technology is changing that too. Advanced laboratories can process tests faster, AI-assisted radiology can flag urgent findings, digital health platforms can deliver reports almost instantly. Some executive health centers now complete full assessments in a single day. That dramatically improves the patient experience. And experience matters. Healthcare environments shape behavior, a comfortable setting, efficient workflows, clear communication, shorter wait times, digital reporting. All of these make a difference. People are more likely to engage in preventive care when the experience feels smooth and convenient. That may sound minor, but behavioral science shows over and over again that convenience drives action. Now let's answer the most common question. How often should health checkups be done? The answer depends on age, risk, lifestyle, and medical history. Not everyone needs the same tests. For healthy adults under 30, with no major risk factors, a structured assessment every 2 to 3 years may be enough. Basic blood work, blood pressure, lifestyle review, body composition, metabolic assessment, between 30 and 40. Every 1 to 2 years becomes more reasonable. This is when metabolic diseases often begin to emerge. Weight gain, insulin resistance, hypertension, sleep disorders. They often appear without warning. After 40. Annual assessment becomes increasingly valuable. Cardiovascular risk rises, cancer screening becomes more relevant, metabolic conditions become more common, preventive opportunities become more important. After 50, annual health reviews should generally become standard, along with age-appropriate cancer screening, colon cancer, breast cancer, prostate discussions, bone health, cardiovascular assessment, vaccinations, and cognitive health. For high-risk individuals, the timeline changes completely. Family history, diabetes, smoking, obesity, previous cancer, hypertension, sleep apnea. These people may need more frequent monitoring. Personalization matters. Now let's discuss what may be the most important lesson of all. Health checkups do not create health. Healthy habits create health. A perfect scan cannot make up for poor sleep. A normal blood test cannot replace exercise. A reassuring report cannot undo years of smoking. Testing identifies risk. Behavior changes outcomes. The best health checkup is not the one that finds disease. It's the one that motivates action before disease develops. The purpose of preventive medicine isn't reassurance. It's awareness. Awareness creates opportunity, and opportunity leads to better decisions. So should you get an annual health checkup? For most adults over 40, yes, but think beyond the standard package. Think about your risk. Think about cardiovascular disease. Think about cancer screening. Think about sleep. Think about metabolic health. Think about wearable data. Think about your future self. Because the future of medicine is not waiting for symptoms. The future of medicine is understanding biology early enough to change the outcome. And maybe the most important question is not, am I sick today? But rather, what trajectory am I on? Because that answer shapes the next 10, 20, and 30 years of your life. I'm Dr. Yende. This is Oxyzen Health Intelligence. And before I leave you with one final question, if you could know 10 years in advance that a major disease was developing, would you want to know? And more importantly, would you be willing to change your habits because of it? Let us know in the comments below, and I'll see you in the next episode.